Brian, you're muted.
Thank you so much, Cyril. Very punctual as always. Thank you for starting the recording. I am going to share my screen and maximize the screen so we can get started. Welcome, everybody, to the first sub-working group meeting of sub-working group 3.1, Preventing Drug Use. My name is Brian Morales. I am the branch chief for counter-narcotics at the U.S. Department of State, Bureau of International Narcotics and Law Enforcement Affairs, or INL for short. It is a pleasure to be with you here this morning. For most of you, for a few of us, it's nighttime in Washington, D.C. and Los Angeles. It's a pleasure to be here with you this today. We are going to provide some administrative announcements from the side of INL, and then we will turn it over to our leadership here to lead us today in the discussion. First, I want to share that this is the public health within the public health working group, three sub-working group meetings that are going to take place over the next 3 hours. This is the first 1 hour session of 3 hours of discussions. Yesterday, we had manufacturing and trafficking and detecting threats and emerging patterns. Those were 4 hours of meetings, four sub-working groups. And last week, we had the same meetings for the Western region. So we've already had 7 hours of meetings, 4 hours yesterday, and 3 hours today, 14 hours per month. At the bottom right hand of the screen, you see an email address, syntheticscoalition@state.gov. That is our email collective. Please send us any questions, suggestions, ideas. We look forward to hearing from you to make your work in the coalition very productive over the coming year. The registration for the working groups and the sub-working groups of the coalition will remain open for the duration of the full year of work that we have ahead of us through September of 2024. If you would like digitally these links, please write to us. We encourage you to share them with other government counterparts, other ministries, agencies, so that they can also participate in the coalition meetings and the associated activities that will occur afterwards. A new coalition website is under development, so the presentations from today that will be recorded will be posted on the coalition website. But importantly, we will not be recording the comments to allow for maximum sort of flexibility and comfort of the delegates to be as open as possible in their comments. I also want to thank international organization coordinators who have volunteered to work with us, and they will be preparing meeting summaries that will also be posted on the website. In the next few weeks, the Secretariat will be sending a meeting schedule for the full year of meetings and the dates, as well as calendar invites, which we have started to do for participants for the next few months. And finally, there's an invitation for, if there is interest, to co-chair sub-working groups 1.1 on manufacturing or 2.1 on data collection, analysis, and trends. We currently have a vacancy in those sub-working groups, so please write to us at the collective if you are interested in volunteering for one of those roles. Now, finally, I want to just quickly share the meeting schedule for the coming months. This month, we are looking at framing the issue, discussing what are the major challenges related, in this case, to the field of drug prevention globally. And then from November to February, we'll have 4 sessions that very importantly will be looking at sharing best practices, models, what are the international global opportunities that we have to work collectively on this issue. And this is much more than a discussion forum. This is a forum to look concretely at operational opportunities for engagement with partners of the coalition. So we hope that we'll have a lot of ideas exchanged and a lot of opportunities identified for collaboration between November to February. In March, we will have a meeting of the working groups, so the Working Group for Public Health, and the sub-working group co-chairs will be reporting to the working group chairs the progress that is being made in the sub-working groups. Then between April to July, we will be looking at action planning and implementation. So how do you actually operationalize the projects and the commitments that we are all making as part of the coalition? We will be looking at evaluation and transitioning to sustainability around the month of August. because in September the coalition will come to an end. Again, the working groups will meet and we will have sub-working group chairs report to the working group chairs the final reports of the coalition. That doesn't mean that the activities will end. In fact, from the month of August, we will be looking at spinning off individual projects and initiatives into other homes, maybe international organizations or associations or other countries that will be leading the charge on other areas of programmatic work for years to come. So we hope to see the coalition's work vibrant and continuing for well into the future. So with that, I'm going to stop sharing my screen and I'm going to welcome today's esteemed panel here that are here to support us. First, I want to introduce our international organization co-chairs. We have Dr. Jo Chung Lin Kiao, the program manager from the Colombo Plan, and Dr. Wadi Malouf, the program manager from UNODC. I'm going to pause so they can introduce themselves.
Thank you, Brian. Hello, everyone. Good morning from Malaysia. I'm Josephine Chung, the Curriculum Development Project Manager in the Colombo Plan Drug Advisory Program since 2014. I'm a psychologist by qualification and trained in preventive drug education in the school setting and life skills for youth. In the last 20 years prior to joining Colombo Plan, I have been actively involved in school-based prevention programming, both at the local and international level. I'm very happy to be part of this bigger initiative, and thank you for having me on board. Back to you, Brian.
Thank you, and thank you so much, Dr. Jo. Let's turn it over to Wadi as well.
Good morning, everyone. My name is Wadi Malouf. I coordinate the prevention programming within the prevention, treatment, and rehabilitation section of UNODC. I'm an epidemiologist by training, and my role is really in the epidemiology of drug use and mental health. Happy to join you all. Good morning to everyone. Over back to you, Brian.
Thank you so much, Wadi, as well. Now I want to introduce our co-chairs for this sub-working group. We have Maria Corazon Dumlao, the Chief Health Program Officer from the Bureau of Learner Support Services, School Health Division, and Ivana Teresin, the Director General of Human Resources and Administration, Ministry of Health from the Seychelles. I'll turn it over to them for their welcome.
Thank you, Brian, for this opportunity to be part of this very noble endeavor. And of course, my greetings to my colleagues and good friends, Dr. Jo Chong and Dr. Wadi. I'm Dr. Maria Corazon Dumlao, the Chief of the School Health Division of the Department of Education Philippines. And we formulate policies, conceptualize programs, and provide technical support to the 47,000 schools, and we support the 27 learners when, as far as health and nutrition is concerned. So I've been in the public health for 30 years. I'm a medical doctor by profession, but my specialization is in public health. Again, thank you for this chance to share with you learnings for prevention. I'll turn it over to my colleague, my co-chair, Dr. Ivana Teresin, the Director General of the Human Resource and Administration of Seychelles. Over to you, Ivana.
Thank you. Anyway, good morning, everyone. Good morning from the Seychelles. I'm not a doctor, just a correction. I'm not a doctor by profession. My name is Ivana Teresin. For the past 10 years, I've been working in substance use prevention in the Seychelles, though I'm currently working in human resources right now. So I'm very happy to have the opportunity to work with you all. Thank you very much.
Thank you so much, Ivana. I also would be remiss if I didn't recognize that we're very honored we have our co-chair from the Public Health Working Group here with us today. We have two co-chairs. One is Ambassador Stephanie Williams, the Regional Health Security from Australia. I don't believe I see her in the participant list, but we do have Secretary Catalino Cui, the chairman from the Dangerous Drugs Boards in the Philippines. Thank you so much for joining, sir. We would also love to hear your welcome.
Stephanie.
Thank you very much, Brian, and good morning to everyone, to our distinguished international organization coordinators, our co-chairs of the different sub-working group, and all the participants. Let me welcome you in all this meeting. And as we return to this hub for the regional and global engagement, we see the prospect of optimism of this group in all its diversity to deal with the synthetic drugs crisis, which profoundly poses as an urgent public health threat to our people. As in our previous meeting, we again call on your openness and objectivity during the discussion on the global landscape and challenges related to each sub-working group to be presided by our expert speakers. By candidly sharing your thoughts and reactions to the presentation, we will be able to create realistic and substantiable initiatives and bring our collective knowledge and capability together to be able to bring concrete and effective outcomes for our sub-working groups. The diverse membership of the coalition would necessarily allow countries to share expertise and experiences from each other. As co-chair of the working group on promoting public health interventions and services, we look forward to your valuable inputs and your suggested efforts in accordance with your respective priorities and resources. The scale of the challenge to this coalition's undertaking is something that needs coordinated action, strong involvement, sincere commitment, and greater passion to help us confront this threat and thus help achieve our common and supreme aspirations that we all live in safe and peaceful world. Thank you all.
Thank you so much, Secretary Cui, for setting the tone for the meeting. Now I'd like to ask the administration here to play our presentation for today. It's actually from Wadi Malouf from UNODC. And following that, then we will enter the discussion phase. Our co-chairs will take over and we'll have the discussion. Thank you all so much.
With the big slides?
Yes, go ahead, please.
Excellent. Thank you very much. So, thank you very much again, Brian. On behalf of UNODC, thank you for inviting us to be part. We're more than honored to be part of this larger group of experts joining us from all over the world. I see some of the windows and I already see many familiar faces. So I want to take time to say shout out to all of you. Thank you very much for being present. And I've been given the challenge task to present on the global landscape and challenges in preventing drug use in 20 minutes. I'll try to give it as much credit as I can, but it is within the context of the challenges that we see in the prevention of drug use that I would like to contextualize the work moving forward. So I thought the easiest way to start is actually to start by zooming in on who are we dealing with specifically. I know we're talking about synthetic drugs response, that's the substance, but I'd rather we focus also on the population that we are addressing through the prevention response. So in terms of setting the ground, there's two ways of seeing this. First of all, in terms of population being addressed. Technically speaking, in prevention, we talk about from a spectrum of care that goes from health promotion to prevention in its universal context, all level of risk, population at large, selective responses, population that is at higher risk than the rest of the population, and indicated the symptomatic subgroups of the population. But in that context, most of the people we're working with are population that is not actually necessarily using substances yet. And within that spectrum of the response, we will find these resolute non-users where we want to reinforce that resolution in them. There will be that subpopulation that with contemplating use that requires probably different areas of engagement to stop them from moving to the next step. And there are these early initiators where need to be addressed before it moves into more complicated modes of response. So that is within the spectrum of healthcare, where I know that there are other subgroups responding more on the treatment side, which is the subpopulation that actually started using and moving within the spectrum of use to different level of problematic use and how to address it. But it is the left side of that spectrum, which is mostly where I'm focusing at least the contextualization of the response moving forward. Of course, that healthcare response is within, the demand reduction response that is associated with the larger supply reduction component, that is the accessibility and availability of these substances that, but that will be the subject of other subgroups. So I thought maybe to start the discussion is like to focus on who are we dealing with in terms of what I'm going to talk about, the challenges with regards to prevention. In that context of that population that we're addressing, the main challenge we have in the field of prevention in terms of addressing it is the challenge of addressing prevention as a science. That science of prevention is one of the key components, whereas there are many ways of formulating that. Yes, there are actions being taken, and this is prevention. Not necessarily all action that is taken with regards to responding to drug use is in the context of the science of prevention properly labeled as prevention. But it is in that context to also talk about the advantage that exists. Now, from a political declaration, political commitment perspective, whether it is with the Commission on Narcotic Drugs, which is the parliament that deals with drugs here at the level of Vienna, or even the General Assembly when the World Drug response is being assessed in 2016 in terms of a joint commitment of taking action, there is that preamble in terms of taking action, not only of a balanced approach between demand reduction and supply reduction, but within the demand reduction, actually within the prevention response that is articulated, data collection, information, and promoting responses that are in line with international standards are there. So basically there is an articulation within that spectrum of response that not any prevention. Needs to be prevention, but not any prevention. There is that articulation of that prevention need to be in line with the standards. So it is in that context where UNODC, in terms of the presence of that standards, that we have jointly between UNODC and WHO, by the way, we have used WHO criteria of reviewing evidence, where we try to work with our member states that we're engaged with to make them really understand what is that prevention that we're talking about, how to perceive it. And that's part of the issue that really require more engagement and work, and it's moving very positively. You'll see in later slides. The fact that prevention is a science, and there is no need for proper improvisation. So there is that science that can support decision-making processes moving forward. Another element these are the sum of the messages, tidbits. It's much larger than that, but these are essential things that we focus on a lot when we're talking with policymakers. The second point being that prevention is not only awareness raising, it goes beyond that. That awareness raising only tackles a slice of the population that needs that information, but it's not the core response of prevention. And especially fear arousal and is not the core component of what the interventions of the prevention standard that we reviewed by WHO evidence reflect that this is what's effective.
Mr. Malouf, my apologies. Interpreters are asking you to slow down a little bit. Thank you so much.
I get a bit overexcited. Done. I will slow down. So the third component is the fact that initiation to substance use is not necessarily the result of a free choice. So it is not a person that's saying yes or no. These messages of just say no to it is not enough in terms of a prevention response. The fourth element that is a core component within that science that we are promoting is that if the point of focus of the prevention is the drug, then the spectrum of response is going to be very limited. Whereas if the point of focus is rather the developing individual and how we can help that person moving forward, that makes a much larger spectrum, a much more comprehensive set of areas of response where we can work on preventing that initiation. Another essential point is the fact that the prevention in line with these standards help personal growth, meaning that the vast majority of the interventions that we have reviewed, again in line with WHO standards of evidence, focus on helping intellectual, language, cognitive, and social competency in that individual, by the way, needed at different ages of development. And that's a key message. Another very important point is that prevention is not a liability that you can invest in or not based on availability of fund. But not investing in prevention comes also at a cost that is at many times more expensive than the prevention intervention itself. And the last message that is essential for policymakers to understand that the worst outcome of non-science-based prevention is not an ineffective response, where it by itself raises an ethical dilemma in terms of wasted resources. But actually the ethical dilemma is much deeper than that many interventions out of all good intention have iatrogenic effect. Iatrogenic effect for interpretation purposes, on not only in non-English speaking languages, is that the intervention itself has caused more harm than the absence of the intervention. It is the intervention that has caused the harm out of all good intentions. And that raises the ethical dilemma to a whole new level. That science of prevention is a key component for policymakers to really reflect on and understand and appreciate. The second issue that we focus a lot on is the fact that prevention is a developmental response. Developmental in what sense? That same prevention standards that I represented on reflects that there are evidence of interventions that happen with evidence of impact on initiation of substance use that can be provided as early as when the child is in the embryonic stage and the pregnant mother onward. And it's not only during the period when substance initiation occurs that the intervention need to happen. So that developmental process allows for an earlier window of intervention and actually allows for a much larger spectrum of social institutions that help with the developmental processes moving forward. But also reflect on the fact that there is not one model of prevention intervention. If we are talking about responses that focuses on social, emotional, cognitive competencies, every age of development has their specific milestones that need to be addressed within these interventions moving forward to have an effect of prevention. I will not spend too much time describing the slides, but I just wanted to describe the developmental perspective that is reflected in the prevention standard per se. The reason why it is important is not only using that developmental perspective in terms of growth of children at different ages only, but it is because that same investment that's being done in prevention, when it's being addressed in the way that is formulated by the standards, meaning supporting the child from birth onward in different ages of development to attain the social competencies need at that age and cognitive needs, you're not only preventing drug use, you're preventing many other negative social and health outcomes. So if we are approaching it as a member state addressing target 3.5 of the SDG 3 on health, that's 3.5 meaning strengthening prevention and treatment responses, that same intervention of prevention that is being strengthened is also providing a spectrum of development for you as a member state on SDG 4 on education, on gender equality that I will refer to more in terms of why gender equality, on SDG 16, especially on 16.2 when it comes to violence and violence against children. So you are supporting more than one SDG in one investment. That reason being is that same science reflects the fact that when we are addressing the problematic, not focusing on the drug, but focusing on the person, you're reflecting on the individual, his or her genetic susceptibility, who they are as a person, their mental health rate, level of aggression, neurological development, stress and reactivity to stress. But that same person, even within the same family, could have different way of interaction with the social structures around them, the microenvironment, the family influences, the school influences, the peer influences. And even these microstructures around the child are living in a larger context. So a family that is raising children in a context of displacement, level of violence, social inequalities is different than a family in other circumstances. So that microenvironment carries an effect on the microenvironment, and needless to say, has an interaction that directly is related to the individual themselves. So that interaction, that's biopsychosocial model that you see, is a key model to address that also is reflecting that return of investment by supporting a person within their own individual susceptibilities as well as the micro and macro environment. That same vulnerability that's being addressed is not only linked to preventing drug use, but also mental health, poor education, and beyond. So that developmental approach is vulnerability is key. Addressing intellectual ability, these competencies are key in different ages of development. And also, each phase of development need a different attention to be provided to prevent that substance use. Needless to say, so far I have not talked about synthetic drugs. Regardless of the substance, being the substance at risk being initiated, the vulnerability has a common matrix that needs to be addressed. That gender sensitivity comes at play because that developmental perspective is key. Boys and girls grow at different developmental speeds and they are affected by the environment in different ways. So also this is a very important part of consideration with regards to prevention response, that there is not necessarily a one-size-fits-all, and even within the same age group of children, that gender sensitivity of the response is also key. And of course, when I talk about vulnerability, it's not only the risk. There are protective factors that need to be amplified on different levels, and there are risk factors that need to be attenuated. So it's working at both levels of the response to overcome that vulnerability. This is essential and is key, including for us as a UN agency, because this is help us not only within the country for supporting more than one strategy, because that strategy of drug prevention now is also linked with the national strategy on violence prevention, is also linked to this national strategy on youth violence or violence against children, but also mental health. But also it's a platform for international organization to come together within the country team to support the country. So basically that same investment is coming on more than one level to help these strategies moving forward from a sustainable development perspective. A third challenge that we would like to highlight is the fact that the culture of research and prevention. That's another area that is also require lots of strengthening. Needless to say, intervention level research available is being more and more visible. More registries are being put. Aside the global registry, there are country-specific registries that are coming up, and this is a key manifestation moving forward with regard to research. But that research demonstrating transferability of the evidence to other countries requires more investment moving forward. And this is something that as UNODC we are supporting. Also advocating for the value of monitoring and evaluation and research, particularly in low middle income countries, not only at the intervention level, but in terms of the general strategic response of the country. Research on scalability and sustainability and cost effectiveness, particularly transferable to other countries, is also key to reflect on. And this is something that is, remains, of course, the science is there and the science is universal. And there's a lot, but that research, that culture of research, generating more and more science from countries outside the usual countries of research is a key component moving forward. The fourth challenge is starting early, early prevention. Whereas, I'm reflecting it as a challenge, but I'm also going to reflect in the presentation that there's lots of opportunities in this. As I reflected before, most of the intervention happened at the age of initiation of substance use in most of the countries where we're working. There's a bit of a hesitance, a lack of investment of responses that are happening much earlier in the developmental ages of children. By the way, I'm talking globally. There are some countries that have it. But there are many countries also that have services, but they have never been considered as part of services supporting the drug prevention responses. Prenatal infancy visitation, intervention for pregnant women, and beyond. These were not because if the intervention itself does not discuss drugs, many times it is not registered in the national strategy of the country where we're working. But we can work earlier, and that developmental trajectory can be affected at much earlier ages than before. However, that change of culture is happening. And in our Commission on Narcotic Drugs in 2022, I would like to draw the attention to a very landmark resolution that was put forth with the Commission on Narcotic Drugs, specifically mentioning promoting comprehensive and scientific evidence-based early prevention. Not early in the sense of the timing of the substance use before it escalates. No, early in the times of ages, starting from 0 to 10 years in terms of intervention, though looking at adverse childhood experiences and beyond. Member state and policymaker coming in and raising a recommendation like this. For those that know us in Vienna know that resolutions of the Commission are by consensus, but they come in sponsored, and then they negotiate the resolution as they move forward. This resolution, just to give you an idea, regardless of the political context where it was presented in 2022, that resolution was co-sponsored by over than 30 countries before it was endorsed unanimously. So that is a reflection of a very positive spirit in terms of engaging in early prevention within the member states. The fifth challenge is the fact that we are so far talking about interventions and when to do intervention. The fifth challenge is systems of prevention. And this is a slide to reflect based on what we've done before, because we're talking about synthetic drugs. The fact that when more than one intervention come together, the amplified effect, the multiplicative effect of prevention, where we have seen, like this is from Crowley et al. From 2014, kids that were followed up from 6th grade onward, when it comes to actually initiation on non-medical use of prescription drugs, a comparison group, which is in gray, compared to kids that have received school-based program of life and social skills as of 6th grade moving forward, that's the green line, you see that a prevention effect is happening. But when we add a family skills and parenting skills program over and beyond this life skills program, you see an amplification of this effect as it moves forward. So that add-on effect of different intervention is a key thing. But it's not the addition of intervention, of evidence-based program only that is key. It is that receptacle, the supportive system that surrounds the intervention, that is also something that we are working on strengthening. The evidence-based responses got plugged in a system of agencies and agents of response that plug in, and it's the combination of the evidence-based response and the system that make the intervention effective or not, even if, per the registry, the program itself is evidence-based. So how the system function is also key. We have reflected on that in the prevention standard. At the base, you see that the value of presence of prevention strategy is a key component, but it requires a range of stakeholders involved in the planning, strong delivery infrastructure, the policy framework, the training of the staff, the human resources, the financial implication, and at the local level, a spectrum of local providers moving forward. So that cycle, that system, is also a very important component to strengthen and highlight when prevention. Apologies. Yeah. So, and this is where UNODC, as well as together with other counterparts, we have started to provide a kind of a structured way of reviewing that prevention system at the level of intervention and at the level of coordination mechanism of the entities that are dealing with the response. The review of the prevention system is one of the new tools that is being added to the prevention response moving forward, where, in a nutshell, to describe it visually, every single intervention is kind of reviewed, arbitrating on the standard basis, and whether that response is evidence-based, non-evidence-based, innovative, weakly evidence-based, or supportive, through a traffic light system that probably is colored beyond just red, green, and blue, but there's a variation. But at least it gives a colorful interpretation of which areas we're strong, which areas are weak, which area need to be strengthened moving forward, and also mapping them out by age groups, by social institution, and by intervention level, going back, is it a universal strategy, a selective, or an indicated strategy moving forward? From a strategic perspective, in terms of SWOT analysis, when it comes to strategy development, most countries have that epidemiological data in the background. However, when it comes to assessing their service infrastructure, that component of the prevention strategy have always been done qualitatively without any kind of a strong scientific backing in terms of where should I go, what's the weaknesses, and how should I address that epidemiological context that I'm dealing with. That's a tool being put forward in terms of supporting that system level moving forward. And actually you can see how it kind of also advocate to start early. But it's not only at the level of intervention, but how the system functions. Its comprehensiveness, its delivery, regulation, research, coordination, and sustainability. These are key important features when it comes to the response over and beyond selecting evidence-based responses moving forward. The sixth challenge is the quality of the prevention. The quality of the prevention, and that also, like, this is something to reflect on from a perspective of, this is where we're working together with different institutions, global institutions, from UPC, EUPC, EDQPS. There are lots of tools. So I talked about what we talk in terms of opening the mind of the policymakers at the very beginning from the prevention standard perspective, and at the service level to have an appetite to provide prevention services. But in between that spectrum, there's a lot of work that needs to be done on the delivery mechanisms that provide these services. So at the mid-level policymakers, at the service provision policymaker, service provision person, it's not only being trained on how to do a specific family skills program, but it's also how to work with families in general. And you know, and these context and the policymakers not only understanding the strategy, but how to contextualize it within different departments. And that sort of matrix of how to build these elements that exist together are part of the mechanisms that we are moving forward to, together with the review of the mechanism, to professionalize that area of prevention. So not only being trained on a specific tool, but being a prevention professional is a different entity that needs to, as more and more, and we have the tools to make it happen. And I talked briefly, I mean, this is one of the tools, for example, to review the quality system and the toolkits, funding specific initiatives with a specific criteria or working with specific criteria of a person that's delivering the process moving forward. So that human resource capacity building for professionalizing the field of prevention to improve the quality, not only in the terms of intervention, but delivery mechanism, is an important component as a challenge moving forward. And I guess, you know, there has been demonstration from it, including from our colleagues from from Peru. Fernando Salazar recently, for example, integrating not only a program of life and social skills, but training on UPC regarding the school-based prevention in general and helping support a change of climate in the school when the program Unplugged, for example, is entered, showcase the amplified effect of prevention by adding this component of changing the structure that's delivering the prevention intervention over and beyond the intervention per se. This leads us to another thing that as UNODC we're spearheading, and this is a briefing in terms of where we are. We are at the stage of launching a new initiative where we need to put all of these contexts in place. That sort of model intervention or prevention, because many cases they tell us, like, who implemented prevention and showcased that prevention worked. We know that in many cases there are lots of loopholes when it comes to investment in prevention. But in terms of a system of prevention, with lots of these evidence-based responses, starting from early age moving forward, it requires more research and demonstration moving forward to encourage that appetite of investing in prevention. And this is where the CHAMPS initiative that we're about to launch as of CND 2024 comes in place. It represents Children Amplified Prevention Services, where we're going to work with a set of model countries. I mean, countries is model countries in general, but it doesn't necessarily, depending on the size of the country, might not be the country at large, but maybe a municipality, a governorate, depending on the size of it, where a system of prevention is put in place over a period of 5 years, demonstrating the effect of prevention on a large scale. These models are key in terms of moving the prevention agenda forward. And the last challenge, I think, that I have in place is implicating youth in the prevention responses. So there are lots of responses that we need to account for, but the youth, especially youth nowadays, are not the youth of before, and the youth of tomorrow are going to be different than the ones. There is a lot of networking and powerful political effect of the youth being engaged in these responses. For us as UNODC strategy in general, and the UN Secretariat in general, youth implication in the response is key, including in our strategy from 2021 to 2025. And that's a cross-cutting commitment that we have, including in the area of drug prevention. We have a youth initiative in place where we empower youth to know that science of prevention and advocate within their countries in terms of how to address prevention. And also we try to implicate them coming together through a forum to talk to that Commission on Narcotic Drugs when they're making resolutions of nothing about us without us. And it's the same thing in terms of providing them with seed grants to demonstrate that the youth themselves can do some action on the ground through the DAPC mechanism, which is a small grant mechanism put youth together. And this is where currently we're working on the development of a peer-to-peer program where the youth can be also agents of prevention themselves to other youth. This is work in progress, and I know many people on the call are part of the expert group meeting that we're going to help us in this development moving forward. That's it in terms of set of slides to at least set the background of the main challenges, and I hope I reflected opportunities that exist within the field of prevention moving forward, especially supporting the other components that are being addressed where it become the population that is actually now started using the specific drugs, how we can address it. So this is where I see the component of prevention leading into the other discussion on the other components. And with that, I leave the floor back to the organizers moving forward.
Thank you very much, Dr. Wadi, for that very comprehensive presentation that sets the tone for all of us. In that presentation, we were able to look at prevention and targeting our population in a different